Southern Oncology Hematology Associates is proud of serving the South Jersey region for over 40 years as an independent community-based cancer center. Our 6 well-experienced board-certified oncologists and 3 nurse practitioners make your cancer fight our fight. Our patients have greater access to a group of physicians who treat all types of cancer. We provide world-class cancer care to our patients with our cutting-edge treatments tailored to suit each patient. Make your cancer our fight with Southern Oncology Hematology Associates.
Welcome to Women's Straight Talk. Today joining us is Dr. Sandalia from Southern Oncology Hematology Associates. And we're talking about cancer and the research. So stay tuned and we'll be right back in just a moment.
I'm not giving up.
I'm not losing hope.
I'm not a cancer victim.
I'm a person living with cancer.
I'm not battling cancer.
I am learning how to live with cancer.
Here, I'm not a patient.
I'm a member.
I'm a member, a Gilda's Club member.
I'm a Gilda's Club South Jersey member.
At Gilda's Club South Jersey, we're helping people realize that they don't have to face cancer alone. Call 609-926-2699 or visit us today at gildasclubsouthjersey.org.
What makes Inspira innovative? The latest in surgical robotics. What makes us indispensable? Our nationally acclaimed breast center specializing in reconstructive surgery. What makes us incomparable? Our national award-winning and comprehensive orthopedic center. It's in the people, it's in the legacy, it's in the network. Inspira Health Network, in it for you.
Look and feel your best for life. Utopia Salon and Day Spa. This holiday season, give the gift of Utopia with a gift card. Massage, facials, skincare, hair design, nails, and more. It's more than a gift. It's an experience to remember. Stop in or purchase your gift card online at utopiasalonspa.com or download our new app and purchase right from your phone. Look and feel your best for life. Utopia Salon and Day Spa.
I had my cataracts replaced by Dr. Tyson. Before I had the surgery, my long-distance vision was getting worse and worse. The procedure takes a very short time. The improvement was remarkable. All of a sudden, my eyes were better than they had been when I first had glasses prescribed some 50 years ago.
Dropless IV-free cataract surgery, another first at Eye Associates. Call and schedule your consultation today.
Women's Straight Talk is brought to you by Inspira Health Network, Southern Oncology Hematology Associates, Utopia Salon and Day Spa, Eye Associates and Surgery Center of Vineland, and Women for Women Medical Associations.
Welcome back to Women's Straight Talk. Today we're talking about cancer and the research. So Dr. Sandalia, thank you for joining us today. We're so excited that you could be here. So tell us a little bit about your background as an oncologist and your involvement with cancer research today.
Sure. First of all, Cassandra, thank you. It's an honor to be here. I'm a board-certified medical oncologist and hematologist. I've been in practice now for almost 8 years. I trained not too far from here in Philadelphia at Hahnemann University Hospital. And currently in my practice at Southern Oncology, I'm involved in clinical research practically every day. It's something that I do every day in my life.
Yes, that is what you do. Mm-hmm. And we are just so happy that you can discuss with us all the facets, all the many facets and all the areas of cancer and research, treatment, clinical trials, and things of that nature to give us a better understanding on what's it all about. So give us a little bit about your background. Tell us a little bit more about your background and how you got started and how did you come to Southern Oncology Hematology Associates?
Okay, so as I just mentioned, I trained at Hahnemann University Hospital, and it was during the second year of my internal medicine training that I decided to become an oncologist. I was just attracted by the intensity, the research, the involvement of physicians with their patients, and everything that the hematology oncology branch brings to the medical field. Now, starting right from my fellowship, we were involved in research. At the time, there was both bench research and clinical research. Since I have become an active clinician in my profession, I also treat patients actively, and I'm now involved in clinical research. So I've kind of moved away from bench research and mostly involved myself in clinical research.
So how would you define cancer research? Because it's so many categories to cancer research. So how would you define cancer research?
Sure. So research, as the word suggests, search, we are finding answers. We're trying to find answers, making new discoveries, therapeutic developments, and finding answers to win this battle against cancer. That's the ultimate goal.
Yes, it is. So what's the goal?
Well, the ultimate goal, of course, is win this battle. How do we win this battle against this dreaded disease? But there are many entry points. There are many entry points to how to get inside and win this battle. So it could be better understanding of the disease at a molecular, genetic level, at a cellular level. It could be prevention of the cancer. It could be early detection. It could be different ways of diagnosing the disease, simpler, more straightforward ways of diagnosing the disease, finding better treatments, finding cures, treatments which are better tolerated. We often hear chemotherapies have side effects, but now we're coming up with treatments which are much better tolerated by our patients.
Wow, that's great. So understanding cancer seems to be a pretty complex task, because we're finding out that cancer is many diseases. So how do you explain that cancer in many diseases? That's pretty surprising.
Yes, of course. Yeah, often we get asked, why don't we have a cure for cancer? And the simple answer to that is it's not one entity. There can't be one pill or one drug or one injection, one shot that can cure it all.
We'll take more about it when we come back in just a moment.
Look and feel your best for life. Utopia Salon and Day Spa. This holiday season, give the gift of Utopia with a gift card. Massage, facials, skincare, hair design, nails, and more. It's more than a gift. It's an experience to remember. Stop in or purchase your gift card online at utopiasalonspa.com or download our new app and purchase right from your phone. Look and feel your best for life. Utopia Salon and Day Spa.
Southern Oncology Hematology Associates is proud of serving the South Jersey region for over 40 years as an independent community-based cancer center. Our 6 well-experienced board-certified oncologists and 3 nurse practitioners make your cancer fight our fight. Our patients have greater access to a group of physicians who treat all types of cancer. We provide world-class cancer care to our patients with our cutting-edge treatments tailored to suit each patient. Make your cancer our fight with Southern Oncology Hematology Associates.
What makes Inspira innovative? The latest in surgical robotics. What makes us indispensable? Our nationally acclaimed breast center specializing in reconstructive surgery. What makes us incomparable? Our national award-winning and comprehensive orthopedic center. It's in the people, it's in the legacy, it's in the network. Inspira Health Network, in it for you.
I'm not giving up.
I'm not losing hope.
I'm not a cancer victim.
I'm a person living with cancer.
I'm not battling cancer. I am learning how to live with cancer.
Here, I'm not a patient.
I'm a member.
I'm a member, a Gilda's Club member.
I'm a Gilda's Club South Jersey member.
At Gilda's Club South Jersey, we're helping people realize that they don't have to face cancer alone. Call 609-926-2699 or visit us today at gildasclubsouthjersey.org.
Welcome back to Women's Straight Talk. Today we're talking about cancer and the research. So Dr. Santelia, tell us, research, I understand, is like we said, it's a very complex task. So it involves a lot of collaboration between the partners for clinical researchers involving all sorts of research. So explain to us some of the partnerships and collaborations that are necessary to.
Absolutely. So you as you alluded to, it is a complex process, and it requires partnerships, collaborations amongst researchers, scientists, clinicians, patients themselves, nurses, nurse navigators who help navigate patients through the various treatment centers. It involves everybody. The research starts in a lab.
Right.
And from there, how do you bring the findings, the discoveries to the patients? So we say it takes a village to raise a child. It's similarly to come up with these cutting edge discoveries. It takes many, not just individuals, also institutions.
Yes, so people, communities, institutions.
Absolutely.
And it is a great task, and with the collaboration of everyone working together, what do you think? How far have we come?
I think we've achieved a lot, and there still remains a lot to be achieved. I think the last 10 to 15 years, or maybe 10 to 20 years, have been pivotal in cancer research. We have learned so much about cancer itself. We have understood better as to what cancer is, where does it originate from. Like I mentioned, the cellular basis, the genetic basis, the molecular basis of cancer. And we are now understanding how to target these cancers better than we had a whole gamut of chemotherapies. Now we hear about immunotherapies, CAR T cell therapies, biologic therapies, all sorts of different treatments that have come about. And it's only in the last 5 to 10 years that we've had this better understanding about these treatments.
That's interesting. So the treatments that we are using today are different from the treatments in the past. So we've come quite a long ways in terms of technology, research, treatment, clinical trials. And so with Southern Oncology Hematology Associates, their focus is mainly on the clinical trials. Any particular focus or type of clinical trials they mainly focus on? Because there's so many, aren't they?
Right. Yeah, so you're right. Our focus is clinical research, and we have collaborated with major consortiums, cooperative groups, and our goal is to bring this research from these universities to our local community.
We'll talk more about that when we come back in just a moment.
I had dropless, IV-free cataract surgery, and my surgeon was Dr. Tyson. You don't have to have the IV, it's just a little tablet you put under your tongue, and the surgery went great. After I got home, I could see and could read. That was an extremely wonderful feeling.
Dropless IV-free cataract surgery, another first at Eye Associates. Call and schedule your consultation today.
Southern Oncology Hematology Associates is proud of serving the South Jersey region for over 40 years as an independent community-based cancer center. Our 6 well-experienced board-certified oncologists and 3 nurse practitioners make your cancer fight our fight. Our patients have greater access to a group of physicians who treat all types of cancer. We provide world-class cancer care to our patients with our cutting-edge treatments tailored to suit each patient. Make your cancer our fight with Southern Oncology Hematology Associates.
Look and feel your best for life. Utopia Salon and Day Spa. This holiday season, give the gift of Utopia with a gift card. Massage, facials, skincare, hair design, nails, and more. It's more than a gift. It's an experience to remember. Stop in or purchase your gift card online at utopiasalonspa.com or download our new app and purchase right from your phone. Look and feel your best for life. Utopia Salon and Day Spa.
Welcome back to Women's Straight Talk. Today joining us is Dr. Sandelia from Southern Oncology Hematology Associates. And we're talking about cancer and the research. So we want you to take a look at this clip.
My name is Dr. Benjamin Negan, and I'm a hematologist oncologist working at Southern Oncology Hematology Associates in Vineland, New Jersey. Cancer is a collection of diseases. All of the cells in your body know how to divide, and they divide and they divide, and when they reach the end of their life, they actually die and they're replaced with new cells. Unfortunately, sometimes these cells get confused and they divide and they divide and they keep dividing. They forget how to stop dividing, or they forget how to die.
I'm Shalja Roy. I'm a medical oncologist at Southern Oncology Hematology in Wineland. Breast cancer is a very common disease, and it's a disease of older women, but we do see it in younger women. Roughly about 1 in 8 women would have breast cancer, so that's how real this problem is. It's a very scary diagnosis, and breast cancer, when it's still in the breast and the lymph nodes, it's a potentially curable disease.
My name is Omar Al-Ustwani. I'm a medical oncologist and hematologist at Southern Oncology and Hematology Associates. Now we understand that there are certain targets on cancer cells that could be affected by certain medications, and those medications significantly improve patient outcomes. We can now engineer patients' own immune cells to make them stronger and to make them recognize cancer cell. Then they could get infused back in the patient to fight the cancer.
A lot of people ask me sometimes, well, when are they going to cure cancer, or why can't there just be a medicine for cancer? Some cancers are caused by infections. Some cancers are genetic. Some cancers are caused by diet. Some cancers are caused by exposures to chemicals or radiation. And some cancers, we just don't know where they come from. There are new treatments coming out all the time, and all these treatments come through experiments, which we refer to as clinical trials. Given that we're a community practice, we generally tackle large national clinical trials. These would be what we call phase 3 trials. So this is when the drug or the combination of drugs, which is new, is almost ready to be FDA approved. We doing the final testing on this. We have currently a clinical trial for breast cancer patients that only allows older patients. It's actually looking at the treatment of elderly patients in breast cancer. There are also many clinical trials which are funded by the drug companies. So for instance, if a drug company has a new drug that it wants to put on market, it has to go through certain FDA approval. So that company will fund a clinical trial looking at their drug, comparing it to the standard of care, and comparing these two treatment options. Now, if their drug outperforms the standard of care, then the drug will be FDA approved. Of course, also if it meets certain safety goals.
The one thing I'm very passionate about is women getting mammograms. And many a times it's unfortunate, but we do hear it quite a bit, is we didn't have the financial resources to do a mammogram. So we do have NJ Seed program where patients who are eligible to have this mammogram or any kind of screening procedure are able to do that at no cost.
There were type of breast cancer that was known to be very aggressive and was known to be very bad, the type that express a receptor that is called HER2. And now, with the help of targeted therapy, one of the drugs that is called Herceptin and other drugs that come to help as well, we're talking about a survival rate from early stage breast cancer with that HER2 expression that is reaching about 93% after years of dealing with the cancer.
I'm very happy here. I enjoy the patients who live in the area, and I do enjoy talking to you guys and teaching you a little bit about cancer.
The other thing that really makes me want to keep doing this is we're not treating one patient, we're treating the whole family, and that is there's no price to that. I think the future of cancer is going to be all targeted therapy or all kind of immunotherapy, where we're going to be so smart that we're going to know exactly what the cancer, what cancer and what we need to treat it with. Cancer is a chronic disease, and that's the hope. That's the hope. That we can convert it into a chronic disease and a patient can live longer with that.
I think what I find the most rewarding today is that we have our hands on the tools we need to understand cancer and fight it better. So we are on the verge of a very important period of time in the journey of fighting cancer. At the end of the day, every cancer patient I meet will create a bond. It means a lot to me and to many oncologists to see their gratitude and to see how appreciative they are to what we do. And it's actually what makes me wake up in the morning and get up and go. It is something that we look for to help others and to feel that we're making an impact on others' lives.
What makes Inspira innovative? The latest in surgical robotics. What makes us indispensable? Our nationally acclaimed breast center specializing in reconstructive surgery. What makes us incomparable? Our national award-winning and comprehensive orthopedic center. It's in the people, it's in the legacy, it's in the network. Inspira Health Network, in it for you.
Bring out your beauty at Tina's Hair Salon, located at 26 North High Street in Millville, New Jersey. Experience the ultimate in luxury hair extensions, 3D coloring, natural hair designs, lace fronts, custom wigs, and makeup artistry. Tina's is the Atlantic City and Soho, New York Fashion Week's creative director for hair. Tina and her talented A-list team of hairstylists bring out the fashy doll look in you. Make an appointment today at Tina's Hair Salon.
Southern Oncology Hematology Associates is proud of serving the South Jersey region for over 40 years as an independent community-based cancer center. Our 6 well-experienced board-certified oncologists and 3 nurse practitioners make your cancer fight our fight. Our patients have greater access to a group of physicians who treat all types of cancer. We provide world-class cancer care to our patients with our cutting-edge treatments tailored to suit each patient. Make your cancer our fight with Southern Oncology Hematology Associates. Women's Straight Talk is brought to you by Inspira Health Network, Southern Oncology Hematology Associates, Utopia Salon and Day Spa, Eye Associates and Surgery Center of Vineland, and Women for Women Medical Associations.
So there are many aspects of advancement in cancer care and in cancer outcomes. Overall, in the United States, cancer survival have improved significantly over the past 2 decades. I think one of the top reasons comes from the patients themselves. Patients becoming more educated is a key factor in this fight. And understanding the game, understanding the battle, and trying to aim for the best outcome possible. Motivation is a key in survival.
The first question the patient asks, it depends on why they're usually seeing us. And as an oncologist, they're always worried that, am I going to pass it on to my kids? Okay. How long am I going to live? Am I getting the best treatment? Do I need to go somewhere else? And do I need to get my affairs in order?
A lot of people ask me sometimes, well, when are they going to cure cancer? Or why can't there just be a medicine for cancer? But the reality is cancer is a collection of millions of different types of diseases. Some cancers are caused by infections. Some cancers are genetic. Some cancers are caused by diet. Some cancers are caused by exposures to chemicals or radiation. And some cancers, we just don't know where they come from.
Doctor-patient relationship is the basis of any medicine, be it oncology, be it primary care physicians or anything. And that's the basis of any relationship or any kind of treatment you're going to start on. Unless that is, that's like a solid ground you have to build your building on top of it.
It is very interesting to see that also improvements in information technology have impacted the way we understand cancer today. Communication is becoming a key factor between all the cancer centers and the research projects around the nation, and even with the Western European countries and other countries. There was an initiative that was launched a few years ago under the name of the Genomic Atlas for Cancer. And what it tried to understand is to study the genes of many cancer samples throughout the nation and trying to understand what were the genes involved in the development of cancer, and therefore understanding ways to target those changes in the cancer cell and thus creating the appropriate treatment for that.
I think the future of cancer care is going to be all targeted therapy or all kind of immunotherapy, where we're going to be so smart that we're going to know exactly what the cancer, what cancer and what we need to treat it with.
The new kid on the block is something that you've probably heard about in the news called CART therapy, C-A-R-T therapy. So what they do in this situation is they take out a patient's immune cells. Note that we're talking about an immune cell, not a cancer. And they take specifically their T cells, which is part of the immune system, and they grow the T cells in a culture. They then actually genetically engineer the T cells to respond to a cancer. And then they inject those T cells back into the patient where they will do the heavy lifting and attack the cancer.
Information is not limited to one doctor or one center today. We are all working on one front, and therefore the information is available for every cancer doctor to contribute and to benefit from those information. And we see the exponential growth in the amount of knowledge that we know today due to all of these advances.
The other thing that's happening, because this is all new, is that we're learning how to use these medicines. We're learning how to combine them. For instance, combining 2 checkpoint inhibitors, or combining a checkpoint inhibitor with a chemotherapy, or combining a checkpoint inhibitor with a targeted therapy. And all of this is teaching us how to use these medications, and it's ultimately helping our patients.
It's so important to have people in the community like Southern Oncology, Hematology Associates, and doctors like you who care so much about the community, the patients, the families, and like you said, it's a whole community of caregivers and institutions that come together to bring information to research so that the research can move forward in finding new treatments and cures for cancer. I'm a cancer survivor myself, so this subject is very dear to my heart, and I know that with all the support and help that I receive from my oncologists and families and friends, and the support is so important in just dealing with the cancers, and also being able to get through this type of ordeal. I'm so appreciative of everyone involved, and I just owe it to all of them for just still being here today to be able to talk about cancer and try to educate as many people as we possibly can. So I thank you again for being with us today and joining us to talk about this topic, and we really appreciate it so much.
Thank you.
And
it's been an honor.
So thank you again for joining us, and thank you, the audience, for watching. And don't forget to join us again next time on Women's Straight Talk.